Today we discuss a new topic, circulatory system. So first we discuss the cardiovascular system. The cardiovascular system consists of a network of vessels that circulate blood throughout the body. Vessels that circulate blood throughout the body, motored by the action of the heart. We will be talking about specific of a heart in a separate lesson. So we will concentrate here on the circulatory system. First is a pulmonary circulation. In that the inferior vena cava is the largest vein of the body. It carries deoxygenated blood back from lower part of the body to the right atrium of the heart. This blood carrying carbon dioxide, the supravena cava is above the heart and carries deoxygenated blood from the head and arms to the right atrium of the heart. In that the from the right atrium the blood flows through the tricuspid wall to the right ventricles and then onto the lungs through the pulmonary valve and pulmonary artery. Next is in the lungs, the blood exchange the carbon dioxide is carrying for oxygen. The fully oxygenated blood now flows back to the left atrium of the heart through the pulmonary veins. Next circulation is a systemic circulation. In that the oxygenated blood leaves the atrium through the mitral bicuspid wall into the left ventricle, gets pumped from the left ventricle through the aortic valve to aorta. In that the aorta is the largest artery of the body. The ascending aorta leaves the heart curve in an inverted U shape, making an arc and then descend downward. Next, at the arc of aorta, three branches extended upward. First is the brachiocephalic artery. Uh, it is quickly divided into the right subclavian artery that supplies blood to the right arm and upper torso and right common carotid, carotid artery that supplies that head and neck. Next is the systemic circulation. Point at that the left common carotid artery supplies the head and neck. The left subclavian artery supplies the left arm and upper torso. Subclavian means it is located below the clavicle carbo. Into the kidney. The kidney is a filter and takes some water and waste product out of the blood. The kidney excreted waste products and water out the body as urine. The descending aortic artery continues downward into the abdomen. It then splits into two major branches. This split is called the aortic bifurcation. The two branches are called iliac arteries. Next is the left iliac artery supplies blood to the left pelvis and legs. The right iliac artery supplies blood to the right pelvis and leg. The next is the arteries. The arteries are elastic tubes that carry blood pulsating walls. The exert pressure against the walls of the arteries as it passes through. The peak pressure occurs during the heart contraction and it is called systolic pressure. The minimum pressure occurs between contraction when the heart expandable entrophies and is called diastolic pressure. This pressure variation within the artery produces a pulse. All arteries have a pulse. Next is a common pulse site used in the check circulation. Like first is a temporal side of forehead. Next is a carotid in that neck, branchial inside the elbow, radial thumb side of wrist, femoral is groin, and popliteal in the behind the knee, dorsal pedis is the upper surface of foot. These are the uh, common pulses site used to check circulation. Next is the average pulse rate of for the person who is resting will be 70. During exercise, that number might increase to between 130 to 140 beats per minute. Count the number of beats for 15 seconds into 4 is equal to pulsation per minute. In that, next is arterioles. Arterioles branches of into seven smaller vessels called arterioles. Arterioles and they two smaller vessels eight called capillaries. Arterioles is act like a adjustable nozzle in the circulatory system, so they have the greatest influence over blood pressure. Next is the capillaries. The capillaries are the smallest of the blood vessels, and the walls are so thin that the molecules can pass through them. They branch out from the arterioles, passing next to the organs, intestine, and throughout all the cellular tissues. Next is the venules. The capillaries now carrying carbon dioxide and cell wasted start merging into bigger vessels called venules. Next is veins. The veins have walls that prevent the backflow of blood when lead back to the heart. Veins are the vessels that are used to remove blood from the body of analysis. Next is the illness of or disease of affecting circulatory system. First is arteriosclerosis. It is a narrowing of arteries from the plaque buildup. Its symptoms like blood clot, would close up, artery causing heart attack. Its treatment like may include a angioplasty which would be prevent the artery from closing up. It's uh, many therapy like thrombolytic therapy, heparin therapy. Next illness point is disease is a cardiomyopathy. It literally means heart muscle disease. It's symptoms like fatigue, shortness of breath, wrist, chest pain, weak hurts. Like its treatment, like it depend on type of cardiopathy, but may include a medication, implanted pacemaker, uh, ventricle assistant devices. The goal of treatment often the symptoms relief, patient relief, or the and last is a heart attack. Attack is a very severe disease in the human body. In that the treatment treatment depends on the severity of heart attack. Its goals of the initial treatment like minimize damage of restoring blood flow of the heart and determine amount of damage to heart tissue. It call critical to call of immediate medical attention. It's therapy like a thrombolytic therapy, heparin therapy. So these are the we discussed the circulatory system and its five illness. So thank you for watching my video.